commitment to education, the impact one local program is having on nursing here on the Central Coast. From new technology to new leadership roles, nurses provide an unparalleled approach to patient care. And one woman's calling to a new career dedicated to helping others. This and much more coming up on Lifeline TV. Hello and welcome to this edition of Lifeline TV. I'm Kate Callahan.
And I'm Dr. Christopher O. Tonight we focus on nursing. Any successful healthcare system today is built around an advanced, specialized nursing program.
And Salinas Valley Memorial here on the Central Coast is no exception. In fact, the hospital is a leader in nursing training, technology, and outreach. Just who are these special medical professionals? Let's take a look.
I think this is the hospital by far in the area that supports nurses.
We've got well-seasoned nurses, we've got young nurses that are just straight out of school.
You cannot be in nursing and not love it.
You know, a happy doctor and a happy nurse usually equates to happy patients.
They give us hours to go to class. They actually pay us so we can go to our classes. The staff is great to work with.
You don't have to deal with snow, you don't have to deal with ice and scraping off your car.
I mean, they really want their nurses to be the top of the line. There isn't one doctor here that I would not trust with any of my family members.
We're always improving and always changing and always updating and adapting to new technologies.
We got the best team here, the best team.
Education is key to success in any profession, and when it comes to future nurses, Salinas Valley Memorial has been a leader in supporting training programs for the next generation.
Recently, Harden College recognized Salinas Valley Memorial for its support in crafting a hands-on, intensive nursing program that sets the bar for quality nursing care. This is the Salinas Valley Memorial Healthcare System Nursing Training Facility at Harden College. Here they are training nurses for the unique challenges of modern medicine.
This is our official statement that we are naming the new facility. We've moved the nursing program back to the main campus at Hartnell, and we are naming that after Salinas Valley Memorial Healthcare System in recognition of the tremendous support and the invaluable support. I don't think we'd have a nursing program without your assistance. And the caliber is just increasing dramatically.
Salinas Valley Memorial's commitment to nurse training dates back decades. This partnership with Harden College marks a new era in that commitment.
Having good clinical sites is critical to any nursing program, and I've experienced that every place I've served as president. But this is the first time I've experienced a real understanding of what it means to invest in an ongoing way in having strong employees, and you see that here.
Well, the Hartnell nurses, the students from there come and they do a lot of their clinical rotations here, so they get to take a look at the hospital and see if this is also a place that they would like to work in the future. And having a relationship with them sort of bonds them more with the hospital.
And employers are pleased with our nurses and their practice, then of course we're thrilled. And none of that would be possible without the partnerships we have with Salinas Valley and with other practitioners in the area. So that's extremely important to me.
The support was spearheaded by Salinas Valley Memorial CEO Sam Downing and the board of directors.
Harden College nursing program is one of the best in the state, and it's moving forward with a lot of pride and a lot of commitment to excellence.
With some 150 students enrolled, the program's track record is impressive. 90% of these students pass the state licensing exam on their first try, 100% after the second. That tops both state and national average, and is an example of the high caliber of training provided. Why such a high success rate? By partnering with Salinas Valley Memorial, Hartnell now boasts a more experienced faculty and state-of-the-art equipment like that found in this simulation lab.
He has heart sounds, bowel sounds, breath sounds, pulses. He is attached to a monitor so we can detect his blood pressure, his heart rate. We have EKG strips that we run across the monitor. And in the control room where faculty are, we have many different scenarios that we run. So students come in, are given a case study, And we set the SIM man up to represent that case study. Students learn how to interact, when to call for help, who their resources are, what medications to give, and so forth.
This advanced training prepares nurses to excel in school and beyond.
It ripples out into the whole family so that you have better neighbors, you have better schools and better neighborhoods. So we really help to change the quality of life of the valley and the individuals and their families, as well as the quality of life of the patients.
I believe it's vital. I believe it's vital to the hospital. I believe it's vital to Hartnell. When you're a patient in the hospital, many times here you will be taken care of by a Hartnell nurse, a graduate from Hartnell. And perhaps she's gone on to San Jose State or UCSF to get her bachelor's and her master's. But she can speak to you of the fact that she came through Hartnell, which again, you're a community person, you're in the bed, you're being cared for by a local nurse, and you hear that and you think, isn't this great? I'm glad I supported Hartnell, I'm glad I supported SVMH. This is the benefit of it. I have somebody local caring for me.
For President CEO Sam Downing, it's another example of a successful merger of local resources to benefit the community.
I'm very proud of this project. I would say that this is one of the highest priorities of the hospital.
And of course, as Beverly said, just really acknowledging Mr. Downing and the Salinas Valley Memorial Healthcare System Board of Directors for your continued support. It is actually true, without your support, we would not have a nursing program at Hartnell College.
Registered nurses hold a variety of qualifying degrees. Nationally, approximately 18% hold a nursing diploma, 34% hold an associate's degree, 34.2% have a bachelor's degree, and 13% hold a master's or a doctorate.
Educating our nurses with the tools to exceed and evolve is crucial for a healthy community. And that's why nurses at Salinas Valley Memorial go above and beyond the call of duty. They are leaders in their profession, and their accomplishments are truly impressive.
The role of nursing has changed. I remember when I first started at Salinas Valley, and nurses were always considered as an important part of the facility, but not the critical decision makers for the patients. You know, they were kind of considered as a augmentation to the physician.
Nurses at Salinas Valley Memorial have an impressive and broad-based level of experience. In many cases, that experience and expertise is put to work beyond the bedside. Nurses at the hospital hold leadership positions, management roles, they spearhead committees, and elevate the quality of care throughout the hospital.
I am actually chairing the Policies and Procedures Committee at the hospital.
I'm one of the co-chairmen for the Bariatric Project. The Bariatric Committee is about trying to develop a safe patient lifting protocol for all the staff that help to move patients around the hospital so that staff doesn't get injured in moving patients and that the patients aren't injured while they're being moved.
The hospital is also getting more nurses involved, or nurses want to get involved so that they can decide how they actually, want to practice and make sure that they're doing the best that they can for their patients.
And doing the best they can means delivering quality care, making every patient feel safe and at home in a hospital setting. One way nurses are doing this is by implementing a streamlined set of procedures called Universal Protocol.
The whole idea is to make sure that you have the right patient, you're doing the right procedure, and at the right time, and that it's a safe time to do it.
Nurses are actively involved in various leadership committees throughout the hospital, particularly in the development of evidence-based practice.
We are the individuals that are there at the bedside constantly, and we're not just there to give them a back rub or to, wipe their brow. We're actually there to do assessments. We're collecting data. We're putting all of the scientific information together, and then we're coming up with a nursing diagnosis along together with the physicians, and that we're truly giving these physicians, other clinicians, very important information that really makes a difference in the care of the patient.
Through their efforts in providing quality patient care and assuming leadership positions throughout the healthcare system, the nurses at Salinas Valley Memorial are preparing for the highly acclaimed recognition of magnet status.
Our board has always been responsive to the needs of nursing, and this leads for greater excellence in patient care and greater satisfaction among the community members when they get this great care at our hospital.
And while moving forward with new policies and procedures, leading committees, embracing new technology, and applying for magnet status, one thing still remains the same for nurses at Salinas Valley Memorial.
As far as the nurse and the patient relationship, it's pretty much the same as it's been all these years. And it's a special relationship that you don't really share with too many other people.
Every day it's another story, another experience, another relationship that you make. It's really wonderful. You know, you're there at really pivotal times in someone's life, and they share with you things that very few people know about them, and it's a real honor to be a nurse.
We've seen dramatic improvements in medicine in recent years. One of the driving forces behind improved care is specialization. Doctors and nurses with expertise in treatment.
With specialization, the bar is being set higher. These standards require intensive training. Salinas Valley Memorial is a leader in providing the kind of specialized training for nurses that delivers the highest level of care in this new era of medicine. It takes not only commitment, but a lot of hard work.
So much of that hard work centers around training. Nurses face demanding challenges daily. To prepare, the training is almost constant, like this emergency drill.
So don't move around, just relax.
Superb job by nursing staff.
And in the classroom, where experts are brought in to share the latest technology and techniques. For many, it's inspirational.
What kinds of things come to mind?
Sessions such as these inspire and educate staff nurses, confirming the pivotal role of nursing for the health and well-being of every patient.
Nursing in particular plays an extremely important role because we're here 24 hours a day, 7 days a week, every day of the year. And so we have a way in which we monitor and watch what happens over the shift, over the days in which a patient is here in the hospital. So we have a pivotal decision-making role. So we believe that nursing plays a significant role in patient safety.
And what does nurse education mean for the community? A safe, comfortable environment for all patients. In short, it sets the bar for quality care. Next, a new advancement that takes patient safety to a new level, combining the skills and expertise of the pharmacists, physicians, and of course, nurses to streamline medication delivery.
It is called the Electronic Medication Administration Record Bedside Medication Verification. That is a mouthful, but simply put, the EMR-BMV is a system of procedures to ensure patient safety. It's been in development for some 2 years and puts technology to work in maintaining the best in patient care. The process starts here in the pharmacy, where every piece of medication is given a barcode. Each patient wristband is also marked with a barcode. So when a nurse delivers medication to a patient, the nurse can scan both the medication and the patient wristband. The information is verified, indicating that the patient is getting exactly what the physician ordered.
What it provides for our patients is a comfort. It's like having a warm downy blanket around you, knowing that now you're in an environment where you know not only are the care providers and the organization committed to your safety, but now you have one more safety net wrapped around you to prevent a potential error or oversight. Because we have a system such as barcoding, it allows for standardization of the way we communicate so that the whole continuum, starting from the patient in the emergency department or in the ambulatory care center, to the inpatient arena, to the physician, and the nurses that care for that patient, they are all speaking the same language when they look at that medication that's administered. So it's a standardized language.
After a visual check and a scan of the wristband, the nurse at the bedside will then scan the medication.
If, for example, it was not the correct medication, I would get an alert.
This step-by-step procedure directly at the bedside reduces medication errors.
We've improved our processes in terms of safety. We've improved efficiency. We definitely have improved the timing at getting the drugs administered at the right time. All of these put together make sure that we're doing the best job in terms of administration of medication.
For an example, prior to the nurse giving a glucose medication such as insulin or an oral hypoglycemic medication, the current blood sugar will pop up on a screen and the nurse then can acknowledge it. If the blood sugar is too low, they perhaps will not give the medication.
I would describe EMR-BMV as being a layer of safety that we provide for our patients to make sure that they get the correct medication that the physician has ordered.
Once the correct prescription is identified, the system allows the nurse to double-check the dose of medication, when to give it to the patient, and how to administer the medication.
Okay, now I'm ready to give it to you.
It's actually streamlining the care that they give their patients and improving the time efficiencies with the patient, because now it's a one-stop shop where they're doing all of this at once.
A one-stop shop that continues to put patient safety first at Salinas Valley Memorial Healthcare System.
The organization looks every day in every way to look to improve the way in which we care for our patient. And again, it's that philosophy of putting a safety net around our patients and what we call creating a safety culture.
That it really, really cuts down on medication errors, and to know that we're doing, expending the effort to minimize those is certainly very comforting as a physician caring for these patients. So.
Did you know the U.S. Health Resources and Services Administration estimated last year that our country's nursing shortage would reach more than 1 million nurses by the year 2020? They also reported that every state in the country will experience a shortage to some degree by 2015.
The impact of nursing extends far beyond the bedside. They provide comfort, medical care, and some even provide inspiration.
Meet a truly remarkable woman, Susan Burnell, who turned a devastating life experience into a new path for self-discovery when she became a nurse. Susan Burnell's story is one of inspiration from tragedy.
My husband and I were pregnant with our second child, just about starting our life together. One morning he woke up with a backache, and his little backache turned into a dissecting aortic aneurysm, from which he suffered a 13-month illness and eventually passed away.
Dwayne spent 4 months in the intensive care unit at Salinas Valley Memorial. Here, a highly trained team works with the most seriously ill patients. In them, Susan saw her future.
That experience brought me to what nursing was all about, and the nurses that cared for my husband were my family, and they took care of him and myself and my children in a way that I can't even explain. And I knew after that experience that nursing was the career for me.
Susan Burnell found inspiration and strength to move forward from her time with the ICU nursing staff at Salinas Valley Memorial Hospital. Today, she has been a Level 2 staff nurse for 3 years in the 26-bed ICU step-down unit, also known as the Progressive Care Unit. She has earned her BSN and is working on her Staff Nurse 3 project. She makes time to be a volunteer bereavement facilitator for hospice and runs a support group for young families who have lost a parent.
Those nurses were the reason that I'm here today. They taught me how to care for a patient in a way where I believe that that patient is my family member. And I respect the family's wishes and beliefs. I chose SVMH over the other hospitals in the area, specifically because of the level of support that they give their nurses. The level of education and professional development is by far, it goes above and beyond what I had ever even imagined that this place could be.
She helps us with our homework, and she's really smart. So she got to nursing school and graduated. I'm very proud of my mom. I'm really proud of mom too.
Nurses often work long hours hand in hand with one another. The bonds formed in these partnerships often last a lifetime. They are professional colleagues, but also friends. As we show you here at Salinas Valley Memorial, those friendships are a remarkable source of inspiration.
Hi, Shani. Hi. Hi, thank you.
This is Dawn Bedard's first day back on the job as a registered nurse at Salinas Valley Memorial Hospital after crisis hit her family.
So it means I need to switch papers, and I will do that.
Ted is Dawn's husband, also a nurse at Salinas Valley.
Well, my headaches started in mid-October. After a while, the headaches were getting worse and worse, and so I thought, this is something different. This is not right. So I went to my family doctor and said, I hate coming to the doctor for a headache. That wouldn't be me, typical nurse. You got to be dying before you go to the doctor. He sent me to get a CAT scan and then an MRI, And he said, yeah, this is a brain tumor and it's filled with fluid. At that point he said, we have to remove this surgically.
What she thought was just back pain due to the stress of Ted's situation, Dawn actually had a herniated disc in her spine and also needed surgery.
And so I went to the doctor and I thought I better get this taken care of so that I can be here for Ted. I found compression of the spinal cord in 3 places. In fact, I had like a hair's breadth of spinal cord left in one place, and so I needed surgery.
From the bedside to their home, the nursing community at Salinas Valley Memorial came together to support Dawn and Ted.
When Ted was getting released from the hospital, and they came in, cleaned my home, did our laundry. In the same time, I was just so amazed that all of a sudden, our family isn't here, but our family is here, and just the absolute support was incredible.
And they had a schedule drawn up, and every other day someone would appear at the door with a meal, a big pot of something or other. So we could look on there and see who was bringing dinner and I think they even wrote what they were bringing.
Yeah, they did.
So I could plan my expectations ahead of time.
Their constant support was invaluable, and for Dawn and Ted, it made all the difference in the world.
One of the girls had come in to visit Ted, and I decided to just go for a little walk, and as the hospital is not far from here, as you know, it's just a block or so. And I actually walked up and looked at that little sign as you leave, and it says, "Neighbors who care." And I thought, they truly do. They truly are neighbors who care. I've never really thought that we would be in this situation, but what an amazing positive impact it's made on us.
Did you know that only about 56% of nurses actually work in hospitals? Others are employed in private practices, public clinics, public health organizations, home health care services, and numerous other health-related organizations.
Outstanding nurses are the cornerstone of outstanding patient care. So it is not surprising that when nurses from Salinas Valley Memorial reach out to the community and beyond, they really do make a difference.
Up next, we meet those nurses who have proved to be true ambassadors of Salinas Valley Memorial here locally and around the world. It is at events like this, the annual American Heart Association's Heart Walk, where Linda Miner, a registered nurse and certified personal trainer from Salinas Valley Memorial's Cardiac Rehabilitation Center, brings her expertise and enthusiasm outside of the clinical setting and into the community. In doing so, she helps people realize that life after a heart attack is possible.
These people who are here walking, when they first came to us, they were very deconditioned, and just walking from the parking lot to our department was an effort for them.
I had a major heart attack and went into cardiac arrest and got to feeling better. I went to the Cardiac Rehab Center at Salinas, and the wonderful nurses there helped me get my life back.
This is why I do what I do, and what I do really has an impact on our patients.
Like Linda, other nurses from Salinas Valley Memorial go that extra mile for their patients. It is simply what they do, embarking on medical missions across the globe. Take Laura Bomarito. Her recent trip to Malawi was a remarkable journey where she treated families and their children suffering from one of the most widespread diseases, malaria.
A lot of these people that live in the villages have no ways of making it to medical facilities, let alone the means to pay for medical care. So we started doing mobile clinics, and we went to about 5 different villages.
And Connie Rose, a registered nurse in diagnostic imaging, extends her services in Guatemala.
Every year I go down to help assist with eye surgeries, and we go to a little pueblo in the mountains of Guatemala. And again, it's surgery for the poor, so for those who wouldn't have opportunity to have the surgery. And these people are blind by cataracts down there. I mean, they are not like in the States. When you have a little hint of an eye problem, they take it out. These people are blind without the surgery.
A Level 2 nurse at Salinas Valley Memorial, Betsy Mount is originally from a small island south of Guam. Her home island of Krishai is combating a serious epidemic of diabetes among its inhabitants, and this has prompted Betsy to take action.
There's not very many Crushaians that have the opportunity to do something for their island because of the lack of education. And a lot of diabetes there. There were 385 newly diagnosed cases of diabetes alone last year. They don't have the emergency medical equipment that we have here, like insulin drips. Average age of a heart attack here is in the early 20s. And so that's a huge item there. And they have no cath lab. They have hardly any blood pressure cuffs to monitor blood pressure. So very basic items we're looking at, in treating diabetes and cardiovascular disease are very limited here.
With their skills, education, and resources, other nurses from Salinas Valley Memorial are also able to impact lives across the globe as they partner with Assist International and Rotary International. It's in hospitals in Romania, Sri Lanka, and Hungary where nurses deliver up-to-date, reliable medical equipment.
I enjoy meeting the new people. I enjoy, meeting the nurses, even though normally they don't speak the same language, but we do understand one another. At least, what's nice about it is that they can show me different things and I can show them different things. Nursing is the same, no matter where you go. It's the caring of the patient. It's, being there for them.
Whether it's at home or beyond, these nurses make a significant impact on their patients, providing compassionate, quality care everywhere they go.
And I go there to serve and to help and to pass, some of my knowledge and compassion and love, on to these people.
I feel very empowered that I'm able to do this for them. And I know that it's always been my calling, so I know that I'm fulfilling that dream and it makes me feel whole.
It's really rewarding. You get so much more back doing it than you're giving.
Well, I have the best job, by the way. I have the best job, so I'm really happy to be there and I love working there.
We hope you enjoyed this special edition of Lifeline TV. More information is always available at svmh.com.
From all of us here at Salinas Valley Memorial Healthcare System, we thank you and we'll see you next time.